Hello, everyone. Welcome back to our AOCPMR podcast. I am Dr. Lachlan, who is currently a media liaison for the AOCPMR Residency Council. If you are new here with us with the podcast, this podcast is a part of the AOCPMR Fellowship podcast series, where we explore different subspecialty in PMR and chat with current fellow as well as attending of those specific specialties about their unique experience as well as career path. In this podcast, we are going to talk about the pediatric PMR, which is a very unique field in the PMR specialty. With us here is Dr. Kwok, and who is a recent graduate fellow and current attending at the Baylor College of Medicine PMR, as well as at the Texas Children Hospital. Thank you for being here with us today. I'm very grateful that I could interview you here in the podcast. And I'm sorry, if you don't mind, can you pronounce your name again and for the audience here? And I also want to ask a little bit more about yourself as well, follow up with that.
Absolutely. So Cosmo is my first name. I prefer first name basis anyway, but if you have to call me by my last name, it's Kwok, like a cooking wok with a K in front of it.
Yeah. All right. And so it's just for the audience to know, to making sure that how to call you the correct way. So, would you mind to tell us a little bit about yourself, like where are you from originally, and how did you decide to pursue a career in medicine?
Yeah, I guess if we go all the way back, I was born in Hong Kong. Both my parents were nurses and they met in nursing school in Hong Kong. I moved to the States, to New Jersey at 5 or 6 years old, right around that winter. First time seeing snow, actually. And I guess at a very early age, I was always already interested in medicine and wanted to be a doctor. I think there was always a lot of like medical conversation at the dinner table with my parents being nurses. Went through school and studied hard, I guess, and that path never changed. The only thing that really interested me otherwise was perhaps teaching or coaching athletics. And then I realized later on that you can be in academic medicine, still be that teacher, and also work with adaptive sports, which I guess you may ask me about later.
I will definitely ask you about that later. And this is one of the big things that you do, especially for pediatric PMR as well. Mm-hmm. And so what medical school and residency and fellowship did you graduate from? And right now at the PMR, the Baylor College of Medicine, what's your current positions? And can you explain a little bit about that position for the audience?
Yeah, absolutely. So I went to medical school in New Jersey, pretty close to my hometown. And so undergrad, I went to Rutgers University, and the medical school I went to, oh wow, I've already forgot what it was called. It's New Jersey Medical School. But when I first started, it was UMDNJ, University of Medicine and Dentistry of New Jersey. But then while I was there, they changed their name to also Rutgers. So I also graduated from Rutgers, New Jersey Medical School, and that's the one in Newark. There's two. There's one in Newark and one in New Brunswick, New Jersey, that are actually separate. Actually, that's the school in Newark is affiliated with the Kessler Institute of Rehabilitation. So a lot of us in the class end up going into PMR. In my class, I think we matched 12 students out of like a normal class size, and that was considered actually below average. I went on to do my intern year in internal medicine at Stony Brook University Hospital out in Stony Brook on Long Island, and then my PM&R residency at the North Shore LIJ program, which then added Hofstra onto their name. So I believe right now they're the Hofstra North Shore LIJ program. And then I went on and did my pediatric rehabilitation fellowship in Colorado, under the University of Colorado, specifically at Children's Hospital, Colorado. And after I graduated, I took a couple months off for some, I guess, fun employment, and then a couple months more delay for COVID, but that's okay. And then now I am a assistant professor in the Department of Pediatric Rehabilitation Medicine at Texas Children's Hospital under the umbrella of Baylor College of Medicine.
All right, it sounds like very long, like extensive resume that you just let the audience know. But it's awesome that you have experience like very early in the field of PMR, especially at your medical school that linked with the Kessler rehabilitations. Yeah, that's very nice. And I know that because you're with the early exposure, what some like the main reasons that you decided to specialize in the field PMR as well, especially the pediatric PMR?
Yeah, good question. So going into medical school, I guess going a little bit farther back, sports and athletics has always been a big interest of mine. I ran track, cross country, played a ton of basketball, and would just casually play pickup whatever sport, literally everything with my friends and whoever. And I knew that that was a big opportunity for me and helped shape who I am today. And so I wanted to potentially do something with sports medicine, and kind of with that interest of teaching and potentially coaching. I was like, oh, I kind of want to work with like high school, maybe middle school athletes. It's kind of like my dream job, not like the professional athletes. And I figured, man, I don't think I really want to do like a surgical lifestyle for like orthopedics and stuff. So going into that, I went into medical school with that mindset. And at NJMS, we had like a little soccer club that we would play amongst medical students, dental students, grad students, sometimes faculty attendings, whoever, everybody on campus was welcome to join. And one of the fourth years that would be graduating that year, they were applying into physical medicine rehabilitation. And he's like, hey, Cosmo, you should look into this thing. This is kind of what you're interested in. I'm like, oh, okay. And that was pretty much how I discovered the field pretty early in first year of medical school. So I would say I was pretty lucky and was able to compare all my different rotations to PM&R. And one of the things that actually came close was OB-GYN. And I realized that it was more the babies and the working with children that I was interested in. So I was lucky enough to also get into a pediatric rehab rotation as an elective. Did that with Dr. Mike Armento in New Jersey. Loved it. And I was like, all right, well, I guess this is the path. And I would say at that point, I said I was 75 to 80% sure I wanted to do it, but it was probably higher. And I ended up applying to residencies with the goal of fellowship in mind, but wanted a residency that still gave me a well-rounded education in everything PM&R.
Wow, that's a very, very great story there. Like with the very early exposure to pediatric PMR as well. So I'm glad that you have that strong interest in mind, and actually like at the end and become a pediatric PMR as well. Like achieve your dream, basically. Yeah. So as a pediatric PMR, what is the main role of as a pediatric physiatrist in regard to like, the care of the pediatric populations, and what are the type of patient population that you usually see on the day-to-day patients or taking care of, and what all the medical specialty that you also work with, interact with in your workplace as well as a pediatric physiatrist?
Absolutely. So I guess to explain what I do, I should probably first explain what physical medicine rehabilitation does. I know some of our audience are already residents, but for our medical students that are interested, physical medicine rehabilitation is a field where we work with patients that have either congenital on the pediatric side or acquired disabilities, and our job is to maximize their function. So one thing I usually say and joke about is, the rest of the doctors in the hospital, they save their lives, right? But then we save their functional lives and that quality of life and those things that really make somebody motivated to get out of bed. What are they looking forward to do? And after a stroke or a brain injury or a spinal cord injury, those things look very different than what life was beforehand. So whether on the adult side or the pediatric side, we are there to maximize function. So we use things like prescriptions for therapies, be it physical therapy, occupational therapy, speech therapy, etc. We will work with special equipment and prescribe those pieces, such as such as wheelchairs, different medical devices that help with bathing, showering, toileting, those things that we all take for granted and that like, oh, I have this new weakness, I can't move my legs or my arms. How does taking care of myself look like before I can even tackle those, recreation things for fun? Those are super important, and whether it be adult or pediatric, that's what we do. We also work with things called orthotics or braces, such as those plastic pieces of things, often plastic, that go around the ankles to help give support. And we also prescribe medications for different rehab-specific diagnoses, such as spasticity or muscle tightness, sleep issues, all sorts of things. We have a lot of overlap with neurology and sometimes psychiatry as well, in that we touch base on a lot of things they do, but in a way we kind of take it to the next level, in that we are essentially their primary care person for their function. On the pediatric side, it's a lot of the same diagnoses as the adults. So you've got the brain injuries, spinal cord injuries, strokes. Those things all happen to children as well. We also work with prosthetic patients, so patients that are missing limbs. On the adult side, that's often acquired limb loss, such as diabetes or accidents, but a lot of children are born without the limbs as well. We also work with I forget if I mentioned spinal cord injury. On the pediatric specifically side, there's a lot of congenital diseases that we still haven't figured out what they are quite yet. As we get more and more genetic testing, we also work with people with muscular diseases such as muscular dystrophy, spinal muscular atrophy. Those are big growing fields in terms of where research is for potential cures or disease modifying realm or medications. Our bread and butter on the pediatric side is probably cerebral palsy and other related disorders. We also work with pain management that a little overlaps with anesthesia a little bit as well. We work with electromyography, nerve conduction study diagnostic testing that also overlaps with neurology, depending on where you're at. I'm sure there's a couple other things, but it's a very broad field. So we see all types of patients, but basically it's anybody who is not functioning to what their optimal function may be, and how do we help with that? I don't know if that answered all the parts of your question. I forgot.
Yes, it's basically covering most of it, but I believe
Yes.
that what you mean is that for the adult side, for the adult population, basically whatever we do in PMR also covering for the pediatric side as well. I think the main difference is that pediatric, they are like a growing type of populations, so you have to adjust it based on their level of growth. And like the aging and stuff. Is that correctly describing that, Dr.?
Absolutely. I think you really hit the nail on the head there. Fortunately for our mothers, our children are not born full adult size. That would make childbirth very difficult. So they're born teeny little babies, and they have a lot of growth and development to go through. And we all know that myelination doesn't always finish even by 18 years old, especially in us guys. We're a little slower. So technically, we're still developing a little bit past that 18 years old mark. And so that's one of the different challenges and things that we deal with on the pediatric side, that children are continuing to develop and grow. And that's why sometimes injuries to a very young child may have much different functional outcomes than on the adult side, because they haven't finished or even started a lot of their developmental process yet. Not to mention, wheelchairs that we prescribe, they're going to grow out of them. Braces, they're going to grow out of those things as well. So that definitely plays a big role. I also did remember one of the parts of the question that you mentioned before, specialties that I interact with often.
Yeah.
On the pediatric side, we interact with the orthopedic surgeons and the neurosurgeons a lot from those surgical subspecialties. A lot of our kiddos may need shunts for hydrocephalus, so that's neurosurgery. A lot of our kiddos have scoliosis or other bony alignment issues, so we're often talking with orthopedics. And then from the medical side, we work very closely with neurology. They help a lot with the diagnostic pieces, seizure management, those types of things. And then, of course, we interact daily with physical therapists, occupational therapists, speech therapists, and neuropsychologists as well.
Yes, yes, yeah, that's covered everything I asked for earlier. Yeah, thank you so much again. Like treating kids is very much different from like treating adults, like we discussed.
Mhm.
I feel like it's even more challenging, even the field like a PMR as well. So, what kind of personality or like the quality do you think a pediatric physiatrist should have in order to be like a successful pediatric PMR physician to take care of that type of patient populations?
Absolutely. I mean, hard to say if it's really more challenging than the adult side. I guess that's biases and what draws you into the field. From a personality standpoint, I think somebody who obviously likes interacting with children is very important. I may be too interactive with the children. I end up playing a lot instead of getting work done, but that's okay. But I think that laid back personality can help, but that doesn't mean somebody who's different from that can't become a pediatric physiatrist. I know a lot of my colleagues in residency and folks I've talked to, they love children, they like working with children, but they can't necessarily bear seeing children suffering or having trouble with function. So they end up not going into pediatrics because that's just something that they can't take home. And I think that's something that if somebody's really interested in working with children that in the medical field, I think it's important to get some of that exposure, get some of that experience to see if that is something that is an issue you run into, or if it's something that you deal with much better. So I don't necessarily think that it's more challenging. I think it's just different. And it's certainly going to be more challenging for somebody who's not used to it or hasn't trained in it. But one of the things that one of my co-residents or one of the nurses I was working with asked me is like, "Aren't you afraid of working with the parents?" I'm like, "Well, there's always only really two parents, but all these the older adult folks in our rehab unit, they have 2 grandchildren, 3 children, they have their spouses, and
That's
so
true.
that's even more of a zoo to deal with sometimes."
That's true. Yeah. Yeah, that's something that I like when they ask you like how would you like deal with the parents wise, but you're right, like is if you think about though they have a lot more family to deal with as well. Not like when you say maybe family is the thing that turn you in pediatric, but actually they'll also have family to deal with as well. Yeah,
Mhm.
totally agree with that. And so I know that you as a pediatric PMR physiatrist right now, you probably like working the field for a while now. So, what are some of the pros and cons that you could tell a residents who are interested in the
Mhm.
field of pediatric PMR if they like want to pursue that as a subspecialty?
Absolutely. So I think the pros and cons, the we'll start with the pros. The pros are that my patients are much more adorable and more resilient than the adult side, so that's awesome. And I have a lot of fun at work working with the kiddos, and there's a lot less kind of BS, we'll say, and it's just they're so resilient, and it's just so fun to watch them really progress, and they're just so genuinely happy. Another pro is that I've heard some folks in rehab that I've talked to, like, "Oh man, I want to do brain injury, I want to do spinal cord, but I don't know if I want to do I don't know how to choose between the fellowship." But well, in pediatric rehab, we still do everything, right? We are still essentially generalist specialists, I guess. We work with every diagnosis and every different kind of subspecialty in rehab, but just on a pediatric population. So we still do pain management. We still do spasticity management, brain injury, spinal cord. limb loss, all those different things. And that was one of the things that helped draw me to pediatric rehab as well. I didn't have to pick and choose one or the other. And if you like certain things more than others and you don't like certain things, you can still kind of pick and choose what you want to do. So I personally am not as much into pain management or EMGs, so I don't have to do those, and I can do all the other stuff. And so that's definitely one of the perks and pros. We are pretty heavy in the academic side, most of the jobs. So that can be a pro or a con depending on what your interests are. For me, that's a pro. I love working with different trainees, fellows, residents, medical students, students from not medicine like PA students, or not in like MD, DO, but MP students, PA students, we've worked with them as well. Cons, I would say the biggest one, the for sure biggest one, other than like, oh, I don't like to work with children. That's the obvious one. Don't choose this field. The biggest con, I would say, is the length of training. So for those who don't know, physical medicine rehabilitation residency is generally 4 years long, generally an intern year plus 3, or you have a categorical where it's built in. Every fellowship out of rehab is only 1 year. So they're brain injury, sports and spine, spinal cord, there's a couple others I'm forgetting, I'm sure. They're all 1 year. Pediatrics is 2. And so that is now delaying your attending position by 1 extra year compared to fellowship, or 2 if you want to stay general in comparison. So that may play a lot of downside in families and situations that may, of course, vary depending on folks. And of course, the salary is also going to be much less compared to your sports and spine and pain intervention guys. And it may be very similar to a general rehab physician that doesn't have to do fellowship. So I know a lot of people say, and for me it's true, like I'm not in it for the money, but when you've got a family, mouths to feed, student loans to pay, it does play a role. And when the big decisions come to say whether or not you pursue fellowship, I know that these length of training things definitely play a role for sure.
Yeah, well, definitely is a good insight into that, especially like the length of training is something that some people will consider about that. But also the pro is that if you like academic and like interact with children and teaching people, then that's something that you should consider as well. And I know that the process of applying in the pediatric PMR fellowship is a little bit different. Like you said, the length of training is different as well. It's 2 years. So what's the process of applying to a like pediatric PMR fellowship, and how long, again, like how long is the training? What topic will PMR residents learn while they are doing their fellowship as a PMR?
Absolutely.
Yeah.
So that actually is a more complicated question, we'll say. For the current residents who are already on the whole PM&R residency track, you apply during your last year of residency, so during your 4th year. I think the applications, all that stuff open like right away, essentially as soon as you start your 4th year. You're going to want to have your letters of recommendation from folks that you've worked with, preferably somebody in pediatrics, at least one. And then you interview kind of that fall time, and then match is usually in the winter. So it's a pretty quick process, and it's a 2-year fellowship. Some programs start July 1st, right after your residency. Some have a little bit more wiggle room. Some don't start till a week later or a month later, depending on. So each one has their own thing, but everything is going to be through ACGME match, just like all the I don't know all the other fellowships, but every spot is through the ACGME match for pediatric rehabilitation. Now, for the medical students that haven't already applied to residency, there's actually 3 ways to get board eligible for peds rehab. One is through what we just talked about, regular rehab residency plus fellowship. That'll make you board eligible. There are, I think, 4 right now combined residency spots in the country. I think each only take 1 person at a time. That's Cincinnati, Colorado, DuPont, and I think VCU is the 4th one. And so this is out of medical school, you would match into a combined residency where you're going to be general peds board eligible, general rehab board eligible, and also peds PM&R. That length of training is 5 total years instead of 6 for the residency plus fellowship. The third way to actually be board eligible is actually to do 2 separate residencies. So you do a general peds residency followed by a general rehab residency. You wouldn't have to repeat that 1 intern year because your whole 3 years of gen peds counts as that. That total length is 6 and a little bit harder to manage because you're essentially doing 2 separate residencies, 2 separate matches. And sometimes some folks end up taking a gap year because you'd have to apply during your 2nd year of general pediatrics residency to have everything run smoothly without taking that gap year. And if anybody has questions, they're always welcome to shoot me an email or contact me. I'm happy to explain those things. So that would be kind of like the weird thing. I don't think any other rehab specialties or a lot of other specialties have that like couple different ways to approach in. I completely forgot the second half of the question.
I'm sorry. Yeah. That's something like very new that I heard of, like the 3-way that become a pediatric physical medicine rehab. Yeah, especially the last one, like you have to do the pediatric and then you do a PMR. That's very interesting.
That one is super rare. The most common is going to be your normal fellowship.
Yeah, the novel. And okay, yep. I see. Yeah. So my second part of the question is like, what topic, like if a PMR resident go in, and what topic do they learn more, and what do they gonna learn during the fellowship more as well?
Yeah, so it's a lot of the same type of stuff you're learning for rehab residency, but now everything is going to be in the pediatric lens, right? How does all those rehab topics we've learned about in residency apply to somebody who's growing and changing and developing? Unlike your adults who are already done growing, you're just trying to get them back to their baseline. Right now, a child, what is their new baseline? How do you know where their projected growth and development is? Because now you've had this change while they're still trying to develop and grow. So that's where some folks like neuropsychologists can help a ton with projecting the learning and like neurologic outcomes. Other things are like disease processes that you don't see on the adult side right away, like cerebral palsy, other congenital things. So those are often new for folks. Though I will say I have seen some cerebral palsy on the adult side during my residency training, but it's different when, and for those folks, a lot of the issues with growth and development have already been taken care of and because they're done growing. But even with something that's supposed to be a static disease that isn't progressive like cerebral palsy, you still have complications and issues and changes with growth and development. Their spasticity may get worse. They're growing, so you need to update their equipment, all those things. And then making sure that their growth is normal for them, but also normal for their disease process or what you can expect of it. So that's where the training is different. And you're really getting to that, what I was saying before about that generalist specialist, that you're still learning everything in rehab. So there's a lot to learn. So some folks, depending on where you went to residency, may be ready after 1 year fellowship. Some folks may not. And I think that's why it's generally a 2-year fellowship, just to make sure we cover all the bases, because the pediatric exposure during residency per ACGME requirements are not very, there's not a lot, right? It's still, I think, 2 months total of your whole residency, 2 out of 36 months, or I might be wrong about that, but not a lot. So, and then we also work with things that are, maybe we do more on children, like Botox and phenol injections. I know we do that on the adult side, but I feel like we do that more on the pediatric side than adults. Backlift and pump management, again, that's both sides, but we have lots of kiddos on backlift and pumps. It's probably a couple things I'm missing here and there, but the gist is that the kids are different. They're not just little adults. They are growing and developing and changing. And that's why it's important to learn about those things that we don't always necessarily see on a rehab residency that the pediatricians may from a normal growth and development. Now everything's altered. So you have to know the normals before you can know how to deal with the altered stuff.
Yeah, I totally agree with that, especially when you say like, what is their baseline now? Like, how like how they're gonna develop into a new baseline. Definitely need the length of training is definitely equivalent of how to figure that out. And I believe that you also being a faculty of the BCM PMR, the Baylor College of Medicine PMR fellowship as well. Is that correct? Um,
I don't know if there's a distinction between the two. I don't. Not some of this stuff is kind of beyond my awareness of how exactly everything works on that side. But I do all of my normal day-to-day work at Texas Children's Hospital,
mhm,
but I'm employed by I'm under Baylor College of Medicine,
mhm,
and that's where our fellowship is under as well.
mhm.
So to me, TCH, BCM, all that stuff is the same thing
I
because that's just
see.
my day to day.
Yeah, I see, I
Um,
see. But I believe that you also involve a lot in the teaching as well in the
yes.
pediatric side, both for the fellow and the resident. So, I just have a few questions regarding that the pediatric fellowship
Absolutely.
specifically at the Baylor College of Medicine.
Okay.
So what are as a fellow at the program, what are some responsibility of a pediatric fellow at specifically at the PCM BMR?
Yeah, so our fellows, their responsibilities are getting that knowledge base, right? That you don't have as a resident, that y- that you need to pick up along the way to become a independent practicing provider on the pediatric rehabilitation realm. So all the things we talked about, all those different things they're learning, but some of the things we also focus on more that you may not always get during residency is systematic training and learning how to be an attending, right? And because that's your next step. Things like how do you manage your workflow and how do you work with residents and fellows and how do you do the teaching? um, Things like the mundane stuff that, of course, right now you don't have to deal with that. I'm dealing with daily: billing, note writing, all that annoying stuff. But also things that are more programmatic, like figuring, oh, do you want to take on the lecture schedule? What does didactics and building those things look like if you're going to be a more academic, right? I'm not a big research guy. I know some of my colleagues are, so I can't speak too much on the research side. But if fellows are interested in research, they are certainly going to have opportunities to do those things. Everybody, whether you're required, or everybody, whether you are or are not interested in research, you're required to do at least a scholarly project and something in quality improvement, because I think that's super important, regardless of whether or not you're in research or not.
Yeah. All
Um,
right.
so there is that ACGME curriculum for our fellowships,
I
but then
see.
we have plenty of pathology and opportunities here at BCM,
Mm,
Texas Children's, that our fellows will be busy if they want to be.
I see. So talking about busy, how is the typical work schedule of a fellow life as in terms of your knowledge about that?
So that's hard for me to say. I'm not in charge of the fellow schedule.
Mhm.
And I was not a fellow here at BCM, so I don't know exactly what their schedules are like day to day. But I would imagine it would be a little similar to residency schedules on the rehab side, so it's not as bad as the current intern year you're in
Yeah,
right now.
yeah.
um, but it's at Baylor's program here. We probably similar to other folks. I can't speak for everybody. I've only done one fellowship, and I can only compare to that. It would be similar in terms of schedule from what I did as a fellow,
Mhm.
where you were on kind of like blocks of rotations, and the blocks were focusing on different topics. So if you're on an outpatient block, you may be seeing certain types of diagnoses, and
Mhm.
there's different clinics to be in. And then when you're on the inpatient stuff, you're focusing on things like the inpatient rehab unit and consults.
Okay, all right.
And I
Yeah,
know, sorry, I didn't mean to cut you off.
yeah.
And I know that we have opportunities for our fellows to explore things that are part of our allied health professions. So
Mhm.
getting over to like New Motion or National Seating Mobility or our ATP companies to see how equipment is done, going to the orthotic places to see how braces are made, talk with those folks, and really get an exposure to the well-roundedness and the different things that we deal with that we may not always get to see because we're busy as an attending now that we have the opportunity and freedom to as a fellow.
Yeah, that's actually my next question. You already answered that. I want
Oops.
to know, like, it's okay. I just want to know, like, as a fellow, like, what's the thing that you can do, be like a special thing you can do as a fellow, not as an attending, but you already answered that. So, yeah, that's very interesting that you can get more exposure in that regard as well. And for a, for just for this question is for like the current PMR residents who are interested in the pediatric PMR. Again, what should they do to make them like stand out as a good candidate for like the fellowship?
Yeah, definitely number one, get that pediatric rehab exposure. I know that's a little easier said than done for a lot of programs that don't have a lot of heavy pediatric exposure. And some programs don't have that elective or away rotation built into that schedule. But if you're really interested and you have that opportunity at your home institution, go do those rotations, right? Do
Yeah.
those early enough so that you can really get a feel for the specialty and see if that's something that's interesting to you. And then, of course, if you're going to be applying, you're going to want those letters of recommendation. So be on your best behavior, and make sure that the attending that you're working with knows that pretty early in your rotation, so that they can
Mhm.
really get you a good letter. I will say the pediatric rehab world is very small. We all know each other or know somebody who knows each other. So it's a very small field. And so um, I think making sure that you really build some of those networking connections is important. If you don't have that opportunity at your home program, talk to your program director and see how they can make that work for you. Because it's your program director's job to help advocate for you and help you get into fellowship. And so maybe they're able to get in an away rotation or squeeze in something to make it work or move some things around for you. Of course, that's going to be all institution specific, so I can't say how to go about doing that. But the most important thing is getting exposure so that you know that you're interested in this, and that when you interview for fellowships, that you can really portray that message. And that's what I would say for your rotations and kind of like your daily workflow. In terms of extracurricular things, if there's research or things going on the pediatric side, certainly go and pursue those. Maybe it's not in rehab, but maybe it's something on the pediatric side. There's pretty much often a lot of adaptive sports opportunities locally. Those are often very heavily volunteer driven, volunteer dependent. So go out and figure out, is there a local YMCA that does programs? Talk to them, see if they need volunteers. There are some national organizations that help with figuring out where some of these opportunities are. Move United is one of them. You can Google that. Look for those adaptive sports opportunities. You can even just Google adaptive sports in whatever hometown or state you're in. Find those opportunities and figure out where those are. And not just adaptive sport, that's just where my interest is, but also adaptive recreation, other activities, adaptive dance, music, those types of things where we're really interacting with that patient population and get some exposure to those things. Those will always be helpful.
Yeah, those are very, very good advice for
Mhm.
those very interested in the pediatric PMR as well. Uh, that's definitely talking about the adaptive sport. I think that's
Mhm.
also one of your big interests as well, and I'm glad that you mentioned this. And so I just actually these next few questions just about you yourself in general.
Mhm.
I know you recently just started working as an attending for the pediatric PMR. So What is a typical day in life as of you as a pediatric physiatrist, and is there any adaptive sport of that component in your typical day in life as well?
Absolutely. So, well, okay, it's December now. So I'm 14 months into being an attending, so a little bit over a year. I would say each attending's different day-to-day life is a little different, especially on the pediatric side, because some of us are going to be more heavy outpatient, some are more heavy inpatient. The setups and how things work in different places are going to be different as well. And then what your contract is with your department, what is your role, right? Some of us, well, I'll say a lot of us are more clinically heavy, but there is a handful, some of us that are more research oriented. So there are these things called FTEs, or which measures kind of like your weekly time. So 1.0 FTE would be like your full-time employment for the week. And so some things will be like 0.1, so 1/10 of your full-time would be half a day, for example, because your week is made out of 10 half days. And so my role is, I think I'm like 0.8 or 0.9 clinical. So 8 to 9 half days I'm seeing patients in clinic, right? Whether that be in clinic or my inpatient role as the inpatient attending or on consults. And then depending on what other people do, sometimes you have some time set aside for teaching and academics, and sometimes you have some time set up for research. Some people may be 50-50, like your MD, PhDs. Me specifically, I have some admin time set aside for developing programs, adaptive sports work, and general, like kind of those extracurricular things as an attending. As well as getting the lectures, teaching stuff, more formal stuff set up. So my day-to-day is pretty much kind of 80 to 90% clinical, and then 10 to 20% academic slash adaptive sports slash admin stuff. But that's just me. I can't speak for the other attendings. So.
I see. And so far, what are some of your favorite moments as a pediatric physiatrist at like the Texas Children Hospital right now?
Oof. It's hard to just pick one. I would say day to day, it's just that day to day interaction is something I always look forward to. Whether it be a new child that, it's scared coming to the hospital, they're not sure why they're there, and helping to lighten up the mood for them and really let them know that, hey, I'm here to help you. We're mostly just going to play, and let them be themselves and figure out how I can help those. That's always a great interaction. And hopefully that's a day-to-day interaction. And on the inpatient side, I would say kind of seeing that more acute, quicker progress, and really seeing the changes that the kiddos go through is rewarding. It's very rewarding when they come back and you barely recognize them because they've done so well recovering on that outpatient side, that like those are always just great things. I don't think I can share specific examples too much without, violating HIPAA things, especially with how unique some of the pathology can be. So I won't go into any specifics, but that's the general gist of rewarding times for sure.
Yes, totally understandable. Yes.
Especially since this is going on the internet.
Yes.
I don't want anybody to be like, oh man, you were describing exactly my kiddo. What are you doing?
Yes, definitely. And you talk about adaptive sport you're working on right now. Can you tell me a little bit like about your interest in that field, and what do you do currently in that adaptive sport field right now?
Yes, absolutely. So, as I said earlier, sports and opportunities, both individual sports and team sports, were a big part of growing up for me. A lot of my friendships were from there. A lot of my experiences and growth as a person were from there, right? Both learning how to do things like teamwork, sharing responsibilities, pushing yourself to compete, and learning where your limits, where you thought they were and where you can push them, and how to achieve new things, set goals. Those things were super important. These were what was interesting to me, but there are other activities and things that will promote the same things. But I want that opportunity to be available for every child, whether you're your typical able-bodied person or somebody with a disability. So if somebody's interested in it and they want to figure out how to do it, it's not about how they can't do it, but how do we modify and make things so that they can do it. I will pretty much do any sport. So right now, specifically with COVID going on, some of the programs haven't fully opened up yet. Um, part of my job at TCH is to build a database and figure out where some of these opportunities are so we can be a information guide and resource for our families. Trying to build up a program specifically with TCH right now, but with liabilities, red tape, that is not moving quickly, I'll say. So we shall see how that goes going forward. But also it's building a database and opportunities for our residents or medical students, fellows, as well as our faculty and non-faculty employees of the hospital to be able to volunteer and help out with these programs, because there's you can't pay somebody to run these a lot of times, and they're just too much of a need. And so a lot of it is volunteer driven, and somebody who's more severely disabled may need more one-on-one help. So it's not always just one-to-one. Sometimes you need to put two people per student or athlete. And so just volunteering, getting out there and helping make these kids' days is a super important piece for sure. One of the things that I did as a fellow that I recently went and did my refreshers for is adaptive skiing and snowboarding. Obviously, there is no skiing or snowboarding here in Houston. And so that's going to be done in Colorado, but my role in that would be being the instructor for the actual kiddo. It's one-on-one. In the case of sit ski, it's actually 2 instructors per participant. Here in Houston, I'm trying to figure out how we can get all the different other sports going, like tennis, basketball. There are already some programs established with other institutions that folks are already involved with. And then somebody who is so weak that they need to use a power wheelchair to get around because they can't stand and they can't even have the strength to push the wheelchair with their arms, that they have to use power. There's actually a power wheelchair soccer where you add a guard to the power chair, and that becomes kind of your legs, and they are able to use their chair to swivel and move the soccer ball towards the goals. A little bit like Rocket League from what I was told from the kids, but they don't get to fly along the stadium. So there's plenty of programs for that.
Yeah, that's a very great example of how you do with the adaptive sport. And you said you do own sport, so that's right there is really good. Especially when you compare with the Rocket League, the game, the video game as well. That's interesting. And they also like have some. I know this because there's some people that also very the kids are very skillful with like video game as well. Even they play in like esport, like shooting game. Those kids like very adaptive to that as well. So maybe that's something that I hopefully can see that at the Texas Children Hospital as well in the future. Yeah.
Actually, funny that you mentioned that. The person who is in charge of the power soccer folks for our muscular dystrophy patients, she's actually was approached me and was asking, hey, do you know of any of the residents, or are you like video game savvy? Because they're trying to figure out how to get we're trying to figure out how to get a video game night for the kiddos so that they can play online with other folks that we know are safe instead of random strangers, and trying to figure out how we can rotate the popular games right now like Roblox or Minecraft, Fortnite, and a bunch of other ones that I may or may not know about. So that's something that it's one of the things on my plate of things to do. So I
I
haven't
see.
chatted with our current residents yet about how savvy they are with computers and games and stuff. I know you are, so maybe I'm going to pull you into that next year.
Yeah. If I'm there, I'll try for sure. Yeah. That's very like video games
Yes.
something I'm very interested in as well. Yes.
Absolutely. So adaptive gaming, right, is super
Hmm.
important, right? There's adaptive sports and modifying how the athlete moves about space or
Hmm.
equipment and the rules of the game.
Hmm.
But something as simple as gaming too, right?
Hmm.
Somebody who may have a contractor or something and they can't access the controller or joystick in a certain
Hmm.
way. There are recreational therapists and game therapists that can help with modifying the controls in those things so that they can
Hmm.
access those things and be able to game with the best of them.
Oh yeah, definitely. Yeah, I would love to see that. Yes. And I know you just also moved to Houston as well. You're from the Northeast and you moved to
Mhm.
Colorado and now you're in Houston. How do you like the city so far?
That is a good question. So I moved during COVID,
Oh yes.
in kind of in the middle slash, I don't know, hard to say where the middle point end point is. And so things were still definitely happening. So I'll say I haven't really explored the restaurant scene. From what I've heard, Houston is very, very multi-cultural.
Hmm.
Perhaps the most, if not definitely top three most diverse city in the US. So you've got cuisines of all sorts of different varieties. And I've heard tons of great things. I haven't explored them myself yet because I've been kind of hesitant about getting into restaurants and doing those things. I've been doing more outdoorsy things. Houston is a pretty spread out city. So it's not like New York City, LA, or Chicago where everything's super dense. One end of like Houston proper to the other end can take 45 minutes to an hour to get to, just because everything is so spread out. Plus, you know, you get some traffic here and there. And then there's also the greater Houston area that has, depending on how far you count out there. But there's opportunities for a lot of different things. There's a cultural scene, sports scene, probably scenes of things I don't even know about because that's just not where my interests lie. But there's plenty of parks as well. I've been playing a lot of disc golf lately, so I've got some of these guys that you toss and throw. And Houston and Texas is actually a pretty good. Probably the best state for disc golf, and there's tons of different courses around Houston as well. So that's actually where I was earlier today. I was playing a round of disc golf with some of our residents, and so that's what I've been up to in Houston.
That's great. That like you can go play thing around at the disco. I think I need to get into that because like I heard about it, but I
I've
haven't.
got you when you get here.
Yeah, yeah, I haven't played it yet. Yeah, definitely. And so you are a very resourceful person based on what we just talked about, what we're discussing so far. And I know that you have a lot of insight into the field PMNR as well as the pediatric rehab and medicine in general. So how can our listener connect with you online to learn more about you and as well as your um, program that you're teaching right now, as well as the pediatric rehab as well?
Absolutely. I guess I'm an old dinosaur. I don't have a lot of online presence with all like the social media, but I guess I do have a Twitter account. So I'm at Cosmo Kwok. So at my first name, last name, no spaces, nothing funny like that. They can reach me there, send me a message, and I can pass on any like emails or specific things if they want to get more in touch with me then that way.
Yeah, yeah, definitely. I'm gonna put that right in the video on if you watch
Awesome.
it on YouTube, so it's gonna be there or in the description of the podcast. And making sure that you just use that as a contact form for our guest here today. And thank you so much again for being here with us and talking about the Pediatric PMR Fellowship. I very appreciate that, especially you are the one that actually interviewed me for the PMR at Baylor College of Medicine as well. And I'm very grateful for like you accepting to be in the podcast today. And to our listener, thank you for listening. And we're gonna see you guys again in the next podcast. Have a good night,
Awesome. It
everyone.
was a pleasure being here. Thanks, everybody. Have a good night.
Bye.